In this morning's Women's Doctor, we're talking about gestational diabetes. That is diabetes diagnosed during pregnancy, and it is on the rise. Mercy Medical Center Dr. Robert Atlas says increasing obesity rates are the major reason, and it's important for pregnant women to incorporate a healthy diet and exercise into their everyday routine. And Dr. Atlas is joining us now with more information. Good morning. Thanks for being here.
Morning, Jen. How are you?
I'm good. So this could be really frustrating for women who are generally gaining weight during their pregnancy anyway, and then to have to manage this as well.
It really is frustrating for them, and it really gets them from the side. They don't recognize that they're getting it, and then we do this glucola test at about 24 to 28 weeks, and then it comes back positive. And then there's a whole lot of things that happen after that, which is, watch your weight gain, watch your carbohydrate intake, balancing proteins and fats and all these nutritions to try and reduce the risk of gestational diabetes to the pregnancy.
And so talk about the dangers of having gestational diabetes.
Yeah, so the real issue is related to fetal well-being. We talk about excessive weight gain in pregnancy, but also the diabetes can lead to fetal macrosomia, which is a very large baby. And the way that a baby grows is disproportionate, which increases the risk of complications related to the delivery process, specifically something called shoulder dystocia, where the head comes out and the baby's rest of the body can't come out, which is a obstetrical emergency. And then you talk about after the birth, there's risk of what's called hypoglycemia or low blood sugars and requiring intravenous lines and glucose to maintain those blood sugars. So it can be problematic for women. The other thing is the long-term sequela of this. We know that gestational diabetes diagnosed in pregnancy increases the risk of becoming a type 2 diabetic later in life. So that's the real problem as well.
So it can impact you even after pregnancy.
Absolutely. And the risk of it coming back and being diabetic in subsequent pregnancies goes up tremendously as well.
So genetics also can play a role in this, is that right?
Yeah, so we see that happen a lot. And when I take family histories at the time of the interview for the diabetes, it is invariable that one or both of their parents have diabetes at a later age. So we know individuals who have family histories are at marked increased risk of this as well.
And so weight then isn't always a factor. What about if you have PCOS? Are you more prone or less prone to get this?
Yeah, PCOS is absolutely associated with the increased risk for developing gestational diabetes. And there's a study out there that suggests people with PCOS coming into pregnancy with one metformin, which is a drug to help women with PCOS, can actually reduce the incidence of gestational diabetes by about 6-fold. So it's really a good drug to be on if you have PCOS early in pregnancy.
Wow. So if you had one piece of advice to give women who are either pregnant right now or thinking about having a baby, what would it be?
And this is a tough one because we would recommend weight reduction. We know that the obesity epidemic is really increasing and impacting the incidence of gestational diabetes, and we know it is associated with increased risk. So if you can lose 5 to 10% of your body weight prior to pregnancy, exercising is critical, and watch what you're eating during pregnancy.
All right, Dr. Atlas, thanks as always for joining us. Really appreciate it.
Absolutely. Happy holidays, everyone.
Happy holidays to you as well. And if you have any other questions or you'd like a referral, just call 1-800-MD-MERCY.